Good afternoon. This is Damian David with Cornerstone Advisors. Welcome back for yet another weekend review. 15 minutes of headlines in the world of COVID-19, followed by a conversation with one of my colleagues, Joe Grinstead, the topic being how to implement multi-factor authentication, why it makes sense to think about it and get that implemented in the day of coronavirus and COVID-19. And then I'll leave you with some music and some visions of the way that we're all helping each other get through this pandemic experience, okay? There's some good people out there. There's not a shortage of people that want to help and people that care. So just some visions of that to help you get through the week. All right, so let's get right into the headlines. This week, 2 weeks after reopening restaurants and businesses in Texas, officials reported the highest single-day increase in new cases over the weekend, okay? So this is just an example. We've been talking about this as states have been relaxing on some of the restrictions around businesses and some of the social distancing guidelines that they've had up until now. What a couple of us might have suspected, which is, having people go and start to re-engage with the rest of their communities, perhaps we would see spikes in new coronavirus or COVID-19, and that is actually what we're seeing. So Texas 2 weeks later, spikes in their new cases over the weekend. Next headline, Major League Baseball. So they're finally hitting the news here. It's got a set of new rules for this season that's coming up. They are going to try to get the season underway. Here's what we're looking at, though. So there'll be no high fives, no fist bumps, no hugs, so no physical contact where they can help it. They've instructed players not to use showers at the stadiums. They should arrive in their playing uniforms. So that's going to be like a throwback to the old days in what we now know as high school baseball, right, where all the players get off the bus already ready to go. So that will be interesting. And also some travel guidelines for those teams that are on the road. They're asking that none of the teams actually eat at the restaurants while they're on the road. And lastly, no mascots. So a little fun out of the baseball season maybe, but maybe that's a good thing too. I know some of these mascots. Another headline, following up on clinical trials of using famotidine. So again, this is the active ingredient in Pepcid. There's been clinical trials, especially places like Northwell in New York, where Dr. Joseph Conigliaro, he's been doing some clinical trials to try to see the effective use of this active ingredient Pepcid to help fight COVID-19. He was recently had a discussion with a couple other people. I have the link in the description. So something, if you have 15 minutes, I think it's just over 15 minutes. Fascinating conversation. It's in podcast form. So at the link, if you click it, you can play it and listen to the conversation. Just kind of tells you his experience with testing and trying famotidine, along with some of the reason in the background of why they decided to try this. What they were seeing. They tied some data elements together and found certain cases of patients had a better plan of treatment and better results for COVID-19. Triggering the clinical trial. So if you have 15 minutes, it's worth listening. Again, the link is in the description. Have at it. Another headline, Moderna has a vaccine for COVID-19. Early in the game, it's looking good. Might be an option for us. And here's the kicker. It's termed to be generally safe. So more to come on that. That's one I'll definitely want to keep a focus on, and I'll try to circle back in subsequent weeks here. And I'll update you as to what they're seeing. Is it still effective? Are they still seeing positive outcomes? Okay, so keep that in mind. All right, I'm going to jump into the stats. Again, week after week, I've been giving you the statistics around COVID-19 coronavirus from a world perspective, along with here in the United States perspective. Really just to understand the progression and what we're dealing with as far as stats and numbers. So let me go through them. World confirmed cases this week, 4.76 million cases of COVID-19 in the world as of the filming of this, which is Monday, May 18th. Compared to last week, we were at 4.18 million confirmed cases. Of that, around the globe, 1.75 million have recovered as compared to 1.46 million last week. And then we've had 316,000 deaths compared to last week's 286,000 deaths. In the United States, we've had 1.52 million confirmed cases as compared to last week's 1.38 million cases. 281,000 have recovered in the United States as compared to 220,000 last week. And then deaths were up to 89,932 deaths since the beginning of this, as compared to last week where it was at 81,779,000. Okay, so those are the stats. Last headline of the week before we get into conversation here with Joe Grinstead. CIO.com released some tips on staying safe during COVID-19, how to protect your systems from security intrusions, breakdowns, etc. One of those tips was implementing multi-factor authentication, or what we coin and term as MFA. Caught up with Joe Grinstead, one of our own here, to talk about a recent project where we helped a client implement it successfully. So let's see if I can jump and transition to that call now, and let's catch up with Joe and hear more. Hey, Joe, how you doing? How's everything going in Texas?
Hey, Damian, things are going good. We're starting to open back up and get back to business. So it's interesting to watch how that's going. And actually got to go out and have breakfast in a restaurant last week. So that was a nice change of pace. You know, it's a little different experience and people are taking it seriously. So I think that's good.
Oh, nice, nice. We opened our restaurants here too earlier this week. I'm going to hold off another couple of weeks. We just hit we're starting to hit our peak here, I think. So I think maybe I'll limit my personal exposure to the whole coronavirus, at least my family. So
yeah, no, I think that's prudent.
Yeah. So hey, continue to stay safe. Thanks. I heard one thing that I think comes up that we might want to talk about, shed some light on is some of the work that you've done. I know we were working with a health system, and we worked on putting some multi-factor authentication in to allow people to access things remotely and securely. Tell me more about that. That's interesting. I have a sense that could be pretty valuable in people's strategy at this point in time too, with more people dialing in and accessing things remotely.
Yeah, no, I think so. That's an interesting one. That project and the work we've done there was interesting. So this customer was they were implementing Meditech Expanse, which, as you know, is web enabled or can be accessed via web browser through the Chrome browser. And one of the things the customer wanted to do was be able to let people come in from the outside directly through the browser. In other words, not having to go through a Citrix desktop or a VPN or any more layers. They wanted to make it as frictionless as possible for their folks, primarily their providers, to be able to access remotely. And they were also a Office 365 customer. So because of that, they have Azure's Active Directory capability. So everybody has Active Directory, but most people have it on premise. But because they're Office 365, they had extended their Active Directory out into Microsoft's Azure AD service. And as part of Azure AD, Azure offers a multi-factor authentication service. And it's kind of cool because unlike some of the in-house systems that are out there from some other organizations where you've got to make the investment in all the infrastructure internally and all of that, this is really a pay-as-you-go type of model. So we worked with the customer to set up, because they only wanted MFA for users when they were external. They didn't want to use it if the users were inside their network. So we worked with the customer and we actually brought in some of our 8K Miles identity and access management cloud experts, and they set up Azure Active Directory to work with users as they signed into Meditech through Chrome from outside of the customer network. And they were able to do the normal, verify the number on your phone kind of setup. And it's been working great. And the customer, again, didn't have to make the significant capital investment in an in-house MFA system from like an Imprivata or something like that. The Microsoft solution is a pay-as-you-go solution. So you essentially pay when someone authenticates. So it's really a much more cost-effective solution from that perspective for the organization. And like you said, it's something now that scales up as as we've had COVID and more people are remote. Multi-factor authentication is even more critical. We deployed multi-factor authentication here in Cornerstone for Office 365 well over a year ago, and as the guy who gets those calls when things go a little crazy in our email with something that's not good, those calls have dropped off. MFA is definitely a way to mitigate some of those phishing attempts and some of that stuff. So it's been a good thing.
Excellent. I mean, people have any worries or concerns if when they start these projects like HIPAA, like healthcare has a whole new set of rules, or whole different set of rules, I should say. What are the concerns? Any?
Well, I think if they're around HIPAA, if you're implementing MFA, you're actually getting more in line with the theme of HIPAA from a security perspective. You're adding security. MFA is a proven way to improve security of systems, and it's a proven way to stop bad actors out there that are trying to get in. There are ways around it, but they're complicated and they're not as straightforward. It involves, SIM swapping and some of that stuff. But as a rule, we're seeing multi-factor authentication make systems more secure. So I think, I haven't heard any concerns other than, I want to be more secure. HIPAA is one of those reasons. MFA is a way to do that.
Yeah, so there's a lot of benefits, right? More security, ISO, all that type of stuff. Yeah, it's great.
Mm-hmm.
How easy is it to get started? Can we help them with that?
We can. We did this project in a little over 3 or 4 weeks from start to finish.
How many different sites? How many people, users about, would you say?
There were about 45 or 50 external users. It's a moderate to small size organization, hospital, it was pretty straightforward to set up. I mean, we got it up and running. The nice part, there wasn't anything really to do in Meditech, because what happens when you sign into Meditech, we're just redirecting them to the Active Directory authentication server, and the AD server knows that if you're coming from outside the network, to challenge for the multi-factor authentication and make sure that folks have that.
Nice, quick, clean, cost-affordable project, huh?
It's one of those that rings all the bells that you like to hear about a project.
Excellent. Well, hey, Joe, I appreciate it. Let's see, I got to put you on the hot seat here since I got you on here. All right, so if you could spend an hour with anybody in the history of the world or current times, who would it be? What would you do?
That's like one of those really oddball icebreaker annoying questions. No, oh gosh, I have to tell you, current times, I think I'd probably want to be like somewhere in the CDC or around like Anthony Fauci or those guys, because this is a world-changing event we've been experiencing, and they're right in the middle of it, and they're seeing and they're caught at that intersection of the science and the politics, which I think are such an interesting place to be. Talk about having to watch what you say when at the same time you're the smartest person in the room and you have a few things to say. It's interesting dynamics. So I think probably Dr. Fauci or Dr. Birx and those folks that are around all that. And I have to wear a mask, of course, and all that stuff. So.
Yeah, unless you don't have to, I guess. Not everybody has, but
yeah,
mask preferred for sure.
Yep, mask preferred.
Well, that's a good one. Hey, thanks much, and stay healthy again, and I'm sure I'll be talking to you soon.
Thanks, Damien. Hey, thanks, and shout out to all of our healthcare frontline folks out there and all the hard work they're doing. We appreciate them.
Yeah, great. All right, always good to talk with Joe. I think it's a timely concept. If you haven't implemented MFA, now's the time to think about it. It's especially useful in this time of COVID-19, where we expect to see a lot more attempts to exploit your systems internally and externally. So there you have it. That was our week in review. Thanks again for joining me. Looking forward to next week to catching you up on the latest in headlines, as well as conversation around some of the hot topics of COVID-19 and coronavirus. I'm going to leave you here with one of my favorite songs and some visions of the way that some people are helping each other out in this time of need and in this time of pandemic. So again, never short of people that want to help, including yourselves. I myself and the other folks at Cornerstone really appreciative of the work and the effort that you're putting towards keeping your communities safe. Thanks. Take care. Have a great week, and I'll see you next week.
When the night has come and the land is dark and the moon is the only light we'll see. No, I won't be afraid. No, I won't be afraid. Just as long as you stand by me. Oh, darling, darling, stand by me. Oh, stand by me. Oh, stand by me. Stand by me. If the sky that we look upon should tumble and fall, and the mountains should crumble to the sea, I won't cry, I won't cry, no, I won't shed a tear, just as long as you stand by me. Oh, darling, darling, stand by me. Oh, stand by me. Oh, stand by me. Stand by me. Stand